Here we're going to demonstrate the finger flexion test. So ideally, the finger pads of each finger should be touching the palm in the vicinity of the distal palmar crease. If you look here, the PIP joint of the middle finger does not fall in line with the other fingers as it's deviating palmarly. So again, you can see that middle finger is coming forward. This is a compensation pattern for the middle finger to try to touch the palm. Another compensation pattern is just to bend the MCP joints, which a lot of patients do inadvertently. So we want to make sure the fingers stay straight. And if they're totally straight, you can see that middle finger is not touching the palm. So we can do the Interossei tension test, also known as the Bonnell-Littler test. And you just extend the MCP joint and then flex the PIP joint of each finger to check for Interossei tension. In a perfect world, you're going to get about 100 degrees of flexion. So anytime I see a finger that's around 90 degrees, I want to investigate it more. And you can see the ring finger here, it gets close to 100 degrees pretty easily, even maybe closer to 110. But if we really extend that MCP joint, we can see that the middle finger is restricted at about 90 degrees. So we can check it by going radially and ulnarly to see which side is tighter. So when I go radially, I get past 90. I'm closer to 100 degrees at that PIP joint. If I go ulnarly, I'm getting stuck around 90 degrees. So that tells me that the second dorsal interossei is the culprit there. Okay, for palpating the dorsal interossei, we need to use a finger on the palm to use as a backstop, and the hand's in a loose fist, and we'll use our fingertip to go in between the metacarpals to try to isolate that tender spot. Mark your tender spots that you find with your fingernail because it's a very small area. If you have difficulty finding a tender spot, you can just do a basic approach, which is lining up with the MCP joint across the hand. I prefer to palpate, try to find those tender spots because these muscles have multiple spots where little trigger points can hide in them. Make sure that you avoid any visible veins. The superficial radial nerve is running over the top of the hand in multiple locations, so if you can, try to feel for that. If you can't feel that and when you're needling you get a zinger, feel electric, remove the needle or back it up. And insert slowly. Make sure you're really in the gap between the metacarpals so that you don't accidentally hit the tendon or the bone. And just try to get dachi. So numbness, dull, achy pressure is ideal. If it's a sharp pain, back it up slightly and redirect the needle. Dachi in this area is pretty easy to obtain. I found another spot on myself that I had marked, so we'll add that one. Again, inserting very slowly, listening. It's important not to be too aggressive with your needling technique, especially in points like this, which are pretty sensitive. Try to get that dachi sensation. You may see a finger jump if you get a twitch response, and that's okay as well. It's not necessary to get the results you're looking for. So just get that dachi and good things will happen. So you could add a Bashe point as well, but let's take these out. Even though we didn't retain them, let's just see if there was any change noticeable. Clinically, I would leave these in. I would retain these needles, and usually I like to leave them in for a minimum of 10 minutes, but you can still see changes even with no retention, with just in and out technique. So We'll hyperextend the MCP, bend the PIP, and we want to see greater than 90 degrees. Ideally 100 would be great. And it's looking better. We're getting there. So a little bit past 90 degrees there when we take it into that stretch position. For fun, let's go ahead and try the Bache point. We only need to do one since we've isolated the exact spot that needs to be worked on, which is that second dorsal interossei. Make sure you isolate that gap and direct the tip of the needle along that gap to avoid hitting the bone or jabbing the nerves that run alongside the fingers, which can be uncomfortable for your patient. Again, get that Dutchy sensation. And let's reassess with our Interossei tension tests, also known as the Bunnell-Littler test. So now look at, we're getting pretty good PIP joint flexion. Definitely closer to 100 degrees, even when we stress it radially and ulnarly, which is a pretty good result considering we didn't retain the needles hardly at all.